Thanks, Rob. Before I begin, the Army's lawyers have asked me just to point out that the opinions and views I express here today are my own, and not that of the U.S. Army or the U.S. government. Now, as a rule, I don't usually answer unknown phone numbers, but I'm glad I did on March 13th, 2020. That call led to a remarkable 4 months with the team at Tufts Medical Center, assisting in their COVID-19 response. To the team at Tufts, you are an inspiration, and it was truly an honor to work with you. Now, I'd like to start with a story, an Army story. And truthfully, they're better yet served in a bar with a raised glass together, but we are in the middle of a pandemic, so nonetheless. So no kidding, there I was. It was 2004 in Tikrit, Iraq, at a base located on the Tigris River. I was a 22-year-old second lieutenant with just over a year in the Army. My platoon and I were about 7 months into a deployment. That day, I was walking from the headquarters to my platoon area, and in the distance, I heard the telltale thump of an enemy mortar leaving its tube headed toward the base. Now, this was a common occurrence. It happened multiple times per day. And as I heard the round whistling through the air, I did exactly what I was not supposed to do. Instead of taking cover in the concrete bunker that was literally 20 feet away from me, I paused. Clouded by 7 months of 15-hour days and very little sleep, I carelessly assumed that it was highly unlikely the mortar was going to hit me, and I kept walking. That's right. Enemy rounds were in the air, headed toward my general location, and I kept walking. Thankfully, I was right. But in hindsight, I cringe at the disregard I had for my own life. I'm also grateful that none of my soldiers saw me do such an incredibly stupid thing. Had they been with me, I would have put them all at risk. This is my first memory of the impact of prolonged crisis on my ability to lead. Now, after nearly 18 years of military service, I'd like to think that I've grown and learned from that day. And during my time with Tufts, I was able to apply some of the lessons learned and experiences that I had leading in crisis. Now, as we know, hospitals are wired to deal with crisis. Life and death is part of their mission. However, unlike, say, a mass casualty event, which might be large in scope, but relatively short in duration, the COVID-19 pandemic has touched every single aspect of the hospital. And it's been exhausting for everyone, from the C-suite to the clinical staff to the support personnel. So how do we as leaders approach these challenges and lead our organizations to overcome them? While there are many things to consider, I am going to focus on two things: decision-making and people. When it comes to decision-making, there are 4 critical questions to ask. First, what are the critical decisions? 2, who makes those decisions? What information is needed to trigger those decisions? And where is that information being kept? With the Tufts Medical Center team, we took time to develop this critical high-level decision matrix. And this exercise was beneficial for multiple reasons. First, it aligned the members of the senior team as to what the critical decisions were, who was going to make them, and at what level. Prior to this exercise, we had discovered that many members of the team were planning based on invalid assumptions about what others in the organization knew or were doing. Second, it generated a list of critical information requirements. This list was distributed throughout the organization to guide leaders in filtering the large amounts of incoming information. In turn, it provided decision makers with the critical insights needed to make timely and accurate decisions. This sort of information triage is critical, especially in the early stages of a crisis, when you are trying to prioritize multiple competing efforts. And third, it fed into the communication cycle of the hospital. With the Tufts team, we developed an operational cadence, or what we in the military would call the battle rhythm. This is the cycle of meetings and touch points throughout the organization. The cadence should indicate the frequency, the audience, and the expected inputs and outputs. And as conditions in the crisis change, it should be revisited to ensure that each meeting is relevant. Because I think everyone here can agree, nobody likes a useless meeting, especially in the middle of a crisis. Now, publishing this cadence to all levels in your organization can help deliver some transparency and combat the fear, confusion, and uncertainty that might be felt amongst your staff. Trust is built within your organization if the team understands how information is being processed and decisions are being made. But trust is nothing without our people. And while this could be an entire talk on its own, I'm going to give you 3 people-focused considerations. First is acknowledge. Acknowledge the impact of the crisis on your team. Acknowledge the contributions of all, not just the proverbial front line. Remember, this is a team effort, and sports teams give championship rings to equipment staff, trainers, and others, not just the coaches and the players. Acknowledge the impact to your team's families. They too are making tremendous sacrifice, especially in the medical field. The Tufts Medical Center team made it a point to reach out to the family members of the team, a gesture that was met with great gratitude. And formally recognize loss and sacrifice. This is poignantly evident as we move into the second year of the pandemic, and many amongst us have witnessed or experienced terrible loss. Second, mitigate burnout and complacency. Remember my Iraq story? I was exhausted. And in that immediate incident, I really just had no regard for my own life. But the reality is that my actions and my complacency put my entire platoon and the mission at risk. Complacency is a threat to all leaders. So how do we do this? I offer to you, rest is a weapon. Once it becomes evident that a crisis is going to persist, it is imperative that you implement, encourage, and enforce a rest plan. All hands on deck is just not sustainable. However, in order to do this, it is critical that you, leaders, demonstrate this behavior. You must recognize your own fatigue and you must take time off. Physical and mental pacing is critical to endure. And third, assess your response frequently. Embrace the after-action review process to assess and reflect on what is going well and what could be done differently. This can be an informal discussion or it could be a structured event. And encourage this type of discussion at all levels within your organization. The Tufts Medical Center team did an organization-wide after-action review that examined key events from the first wave of the pandemic. They in turn were able to apply those lessons learned into the second surge. Embracing an open after-action review process allows for unexpected insights and emergent leaders to flourish. Crisis is a test to any leader. It will cost time and resources to invest in processes that outlast personalities, but this investment will pay dividends and prepare your organization for the next major event. You will always be balancing the interests of the public, the patients, the employees, and the enterprise. And while it is impossible to make all of these parties happy, it is possible to build trust and cohesion by focusing on decision-making and people. Leaders, I wish the best to you all, and I truly look forward to the day we can once again gather together, raise a glass, and say, so no kidding, there we were in the COVID-19 pandemic. Thank you for your time today. I'll now turn the floor over to Massachusetts State Representative Liz Miranda. Liz?